I'm Nigel Wainwright. I'm a clinical psychologist. I work within occupational health at the Yorkshire Hospitals NHS Trust.
And I'm Toria Stocks. I'm a consultant of emergency medicine based basically here at Pinderfields, but I work across the trust as well.
And this is going to be part one of conversations about COVID. We're going to talk about how it's been working in an area that's been treating people who are coming in with COVID-19, but also about the normal psychological reactions that we've noticed within staff and colleagues within the trust. What have you noticed, Toria? How has it been working in the area that you work in?
So I think working in the emergency department is always a busy, noisy place to work, and with the added impact of coronavirus and COVID-19, we've had to adapt what we do quite rapidly. And I think the effect of that adaptation has been twofold. Some of it's been really, really positive, and some of it has driven up or brought up quite a lot of negativity, and in particular thinking about negative emotions, anxiety,
right,
and uncertainty.
Right.
We're really aware that it wasn't something that we had or have any control over, and I think what we've done is try to take control over that as much as possible. In the initial stages, when we planned the changes of our department, and it was physical changes of the setup, what we would do to assess patients, what personal protective equipment we would need, there was a lot of noise, there was a lot of conversations, and a lot of people were included in that, which was really, really good. And I think what's happened is the team as a whole recognise that we need to work together as a whole, and we've come together.
Yeah.
But with that, there's been a huge change. And I think there's always going to be some people within that team who might have felt a little bit left out of those changes.
Okay.
Or even perhaps that some of the things that have happened to accommodate the COVID-19 patient and also to maintain safety of the rest of our patients and our staff might have left them feeling out of the loop, might have also left them feeling a little bit uncomfortable. And I do get a sense of, on a day-to-day basis, a sense of the anxiety that's associated with those.
Yeah. So I guess sounds like there's probably anxiety related to the things that you're describing, but I suppose there's a lot of anxiety out there generally about this virus, isn't there?
Yeah, for sure. We know that we've all got somebody within our family unit or friendship group who might be vulnerable. Perhaps what we weren't aware of is how many of our colleagues might be vulnerable to the illness. Yeah. And we're talking about physical vulnerability, actually. We're talking about getting COVID-19, becoming unwell, what the impact that would be. I have colleagues who've had the illness, who've been at home and they've fully recovered, and that's great to see. But I know they probably won't mind me saying that they also shared a great sense of worry of what if I take it home to my relative? What if they get it? Yeah. Will they cope with that illness? Will I cope with looking after them? And I know that we're all really, really scared of taking it home to loved ones.
Yeah.
There are some colleagues who are also really scared of being unwell themselves and how will they be? And that generates a sense of elevated adrenaline, I think, sometimes at work. And you can also see a little bit of, I don't want to use the word conflict, but you can see that people are approaching anxiety in the same way. And that changes sometimes just the dynamic during the shift.
Yeah.
So we probably see different patterns of behaviour in terms of how we come into the department, how we dress. People are less laissez-faire about their uniform policy, they're very strict. There's a slight element of obsessive behaviour that we start seeing. You know, people are quite vigilant about what they're doing, protecting themselves at work and then protect themselves going home. But that's the physical aspect of it. And I think I know in myself and I know in my colleagues that worry about being unwell. What if I'm the one to take it home? What if that then spreads further? That's really sitting with people, and it's still sitting there for quite a lot longer than I would want. And that's one of the areas that I think, you know, it's nice to just pause a moment and say, everybody I feel shares that worry.
Yeah, this is normal.
And it's a normal worry, absolutely.
Yeah.
Because it's such an unknown.
Yeah. Yeah, and that's okay, actually.
Yes.
It's one of those things, isn't it? We wouldn't choose people to feel that way, but I guess it's the reality right now, isn't it? And it's normal. And I guess how that presents for people, I've kind of had conversations with people about, that will kind of like impact on what they're thinking about just before they go to sleep at night, or what they're waking up with in the middle of the night, and how that spins around in their mind.
Yeah.
And sometimes that people are kind of dreaming about experiences that they've had, or experiences that seem related in some way to that kind of sense of lack of control and unknown and uncertainty, really.
Yeah. In fact, quite a few people have reported that they're finding their sleep patterns really disturbed now.
Yeah.
And some of that is thinking about what's happened during the shift, as you would normally process. I think we all process in our mind what's happened during the day.
Yeah.
I know it helps sometimes to talk about those things, but not everyone wants to or has the opportunity to. And I think, lots of people are wondering why they're not sleeping all of a sudden, or finding it harder to switch off.
Yeah.
And I wonder, and I'd be interested to know your thoughts on this, whether some of that is, it's really hard to switch off from COVID because it's everywhere.
It is everywhere. It infiltrates every part. It's that thing that's at work, it's that thing that's at home. If you've got friends, I've got friends who are either on furlough or they work in industry, and they're kind of like they're kind of working from home right now, and so there's like a barrage of stuff on WhatsApp about that's majoritatively about COVID. And so even when I kind of go to my kind of like link in with my social network, my social circle, it's like there's a lot of chat and speculation about what's going to come and what's going to happen, when they're going to ease restrictions, and how it's affecting their life, really. And so it is the case, there's kind of hardly an escape from it, really. And that's hard.
It is. And it's interesting watching the public's behaviour. So one of the things we've been a little bit more aware of this week, because we're coming into, I can't remember exactly, but it feels like week 6 or 7 of the lockdown, are that patterns of the public behaviour are changing, and there's less responsibility for their actions, and people are starting to do things they would normally do. And you've got the teams at work, I think, are still trying really hard to maintain the changes that are necessary, separate out the COVID, still having conversations with families, which I would like to talk with him more about. But that sense of, at the end of my shift, the end of today, I mean, I've been in the red section today, and I don't know if you can see the red marks on my face still from my PPE.
It's fading.
Good. But at the end of the day, I'm hot, I'm a bit tired, a little bit frustrated, but it's okay, I've done my shift. But I know that I'm not finishing, I'm going home and it's a lovely sunny day and I can go for a walk. But when I finish my shift at midnight, I don't have the same opportunity to kind of, just settle and relax a bit more. And on my days off, all the stuff that I would normally do, socialising with friends, going to a cafe, going to a museum or one of those things, all of that shut. And I think we all find that really difficult.